everybody, and welcome to week 2 of your PEEP placement. I just wanted to drop in and make sure that you'd all had a nice weekend and you were all kind of fit and ready to go for week 2 of your PEEP placement. It's been really interesting to look at your PEEP workbooks over the last week and see the level of engagement and reflection. There's been really positive feedback from staff and clinicians, so I think you are actually doing an amazing job, and it's been really interesting and exciting for us here at the university to be part of this new model of placement, and certainly feedback that I've had from some of the students already has been really positive. So absolutely we will take your feedback on, and there'll be further evaluation going forward. There'll be a little questionnaire to fill in at the end of this week, and your thoughts really do make a difference, and hopefully I'll be speaking to some of you in the future. So really think about how you're going to use this week. So what lessons have you learned from last week? How are you going to structure your learning? Is there anything you feel you need to improve on? How can you relate some of what you've learned to clinical practice? For example, how are you going to take notes in a tutorial, for example, where you don't get the notes in advance? These are all things you're going to need to think about in terms of your patient story or your patient journey. There was some information missing. So, when you meet patients, you will have to collect a social history. You will have to collect a drug history. All these things are relevant. So it's about putting all this learning you're doing in other modules together. So these things don't stand in isolation. So what you learn in cardiorespiratory is absolutely relevant to the patient journey that you're following at the moment, and indeed relevant to every other patient you're going to come across. So, very positive. Remember, we're all here to help you. And I know I will be chatting to you on Thursday, so I look forward to seeing you then. But in the meantime, have a good week. Take care.